Nathan is what I would consider to be a miracle. He is 17 months old right now. He's a very active little boy, loves to listen to music, he loves to kick his feet around, he loves to be outside. We learned of Nathan's diagnosis when I went in for the 18-week anomaly scan. They gave us worst case scenario, but we didn't know the severity obviously until he was actually born. And we knew of the microcephaly during pregnancy. Lissencephaly was not a term that I had heard until after he was born.
Pediatric patients are a unique patient population, and the hospice providers need to have specific tools and resources and training to be competent to provide care for pediatric patients. So you have to understand the stages of development in caring for that population and what the needs of the family are in those circumstances.
In treating the whole family, we take care of the patient. We help parents by educating them, helping to make sure they're aware of the diagnosis, the symptoms that come along with it, disease progression. Nathan has been in the program both in hospice and palliative care. He was born and went home into our hospice program at that time. When his symptoms were better managed, he was transitioned into the palliative care program because they were seeking that information from specialists. Nathan currently receives from our expressive therapies teams massage and music. Massage is involved for his tone. He has very sometimes tight and spastic tone, and so it helps to relax him, release that muscle tension, and provide comfort. And music therapy has been able to help socially engage him with just that one-on-one presence, right in front of his face. He's able to make eye contact. He's able to respond to the music and the instruments.
My favorite times with Nate was when without prompting, he started laying himself down on the big ocean drum that I was playing on his belly. He just kind of leaned forward and started doing that, so he was feeling the vibrations through that large drum. He's been talking up a storm for the past several sessions, which is really great to see.
I think the navigating of the healthcare system is so difficult for some of these families who have maybe multiple children and jobs, and they're trying to navigate all these doctor's appointments. We can advocate and help them get those services.
The goal of the Pediatric Initiative at NHPCO is to, first of all, identify what are the barriers to access for pediatric patients across the country, and how do we provide tools and resources to hospice programs so they feel confident and competent in providing pediatric services for those in need in their communities.
The care team with the nursing staff has really given me confidence with him because there's symptoms that he has that may be typical baby symptoms, but I don't know typical baby.
We were so overwhelmed with everything at the beginning that I don't think we even really understood how helpful they were, and all the people we had around us, how helpful they were, because we were just crawling and scraping to try and get by and do what we had to do to make this work.
I think that a pediatric hospice program is incredibly important because without it, I honestly don't think that we would have been able to take Nathan home at 2 weeks of age and be comfortable enough and confident enough in ourselves to take care of him properly. I think it empowers you as a parent who, the diagnosis, but having somebody there to walk you through everything gives you the strength to work through it and give him the best life that he can have.